At Maryville University. I am going to be doing my head-to-toe assessments this evening. My participant is Tyler. He offered to help me out and do this this evening. Before he came into the room, we took his vital signs. His blood pressure was 134/72. His pulse was 86. His temperature was 97.6. His respirations were 18. We got his height, which was 6 foot. We got his weight, which was 200 pounds. We also did his distance vision all with the Schnellen chart. For this purpose of this assignment, he is not changing into a gown because I don't have one accessible here. So he is wearing a t-shirt and a pair of sweats for this purposes. So we are first going to begin by looking at his face and looking and see if everything is symmetrical. His ears look symmetrical. His eyes are symmetrical with his face. His eyebrows are there, even though they're light, and his eyelashes are all intact. We're next going to be palpating his skull, and we're going to be going from front to back. We're looking for any masses, lesions, or bulges, anywhere in that nature, scars, and I don't feel any. I was also feeling for his hair, and it was thick, it was coarse, and it was soft. It was not brittle. He did not have any receding hairline or alopecia that was noted as well. Next, we are going to be having him smile. If you could please smile, clench your teeth. If you could puff out your cheeks, stick out your tongue, and wiggle it around. If you could raise your eyebrows and wrinkle your forehead and squeeze your eyes shut. Thank you. Next, we'll be testing his sensation. So I'm going to have him close his eyes and tell me if this is hard or soft.
Hard, soft, hard, hard, soft, soft, hard, soft, soft.
Okay, and all his sensation is all intact. Next, we are going to be looking at his eyes, and I'm going to be getting out my pen light here. We're going to be looking at his sclera and his conjunctiva, and we're looking for any redness, drainage, or anything like that. So I'm going to put my pen light in your eyes, pull down here just slightly, and do the same thing on this side. And there's no redness, no drainage, no yellow jaundice color in them as well. Next, we are going to be testing his direct and indirect response. So just stare at me, up at me. He's direct, and now he's indirect, and now direct, and now indirect. And his response was really well, and his eyes were equal and reactive. Next, we are going to be testing his 6 cardinal gazes. So I'm going to have him look at the end of my pen light. This is not on. And I'm going to have him follow it with his eyes only. Don't move your head. So if you can please follow. And he followed it correctly, and he did not move his head at all. He did not have any ptosis at all noted when his eyes were moving. Next, we are going to be doing his uncover and cover test. So if you can hold this piece of paper and hold it up to one eye and focus on a point in the wall. And now uncover, please. And then do the same with your other eye. Please cover up your opposite eye, focusing at the point in the wall. And now uncover. Thank you very much. And now we're going to have him read some letters, and I'll measure to make sure the distance is correct here. Okay. Go in a little bit. There you go. Right there. And if you could read the letters, please.
NGTRSV VRES.
Okay. Thank you very much. and he could read that just fine, so he had no issues with his near sight, near vision. If we actually had the rest bomb test, we'd be actually having him holding it with a string, but I do not have access to one of those at this moment in time. Next, we're going to be moving on and looking at his ears. We're first going to be palpating both his auricles and making sure they are equal and round. There's no scars, nothing on his ears, or no moles, lesions, bumps, scars, nothing there is seen. Next, we're going to be looking in his ears. So we're going to look in this ear first. And we're going to look and see this. You can see the gray in his tympanic membranes, which we can. That looks great. He has no waxy buildup or anything in his ears. Next, we're going to be looking in his other ear.
Hey.
And you can see his tympanic membrane in that one as well. And it looks great. Next, we're going to be testing his hearing. So I'm going to have him cover up one ear, and I'm going to go behind him, and I'm going to whisper a word, and then have him repeat it. So if you could please cover up one more.
Dog.
Cover up your other ear, please.
Orange.
Thank you very much. Next, we'll be doing his Weber and his Rhine test. I'm going to strike the tuning fork, and I'm going to place it on the top of your head. If you could please tell me if you hear each sound equally. In one ear better than the other, or how you can hear it.
It's equal.
Thank you. Next, that was the Rhine test. Next, we'll be doing the Weber test. I will be hitting my tuning fork against my hand. I will be putting it on the back of his mastoid bone, and I will be counting while he is listening. And when he doesn't hear it anymore, I will then move it in front of his ear and have him count. Wait, stop. Okay. Okay. And then now we'll be doing the other side as well.
Stop. Stop.
And his air conduction was longer than his bone conduction, which is a normal finding, so his hearing was just fine for this portion of the test. Next, we will be going down and looking at his nose. And I'm going to use my pen light here, and we're going to be looking up into his nose. It looks symmetrical on the outside. Doesn't look like it's been broken or anything like that. We're going to look up into his nose, and we're going to be looking at his turbinates, his mucosa, and the mucus in there, and his septum. It all looks good. It's pink, warm, and moist in there. His septum was equal as well. Next, we're going to be palpating his face and his facial bones, and along with his sinuses. Any tenderness? Okay. And anything in your maxillary sinus? Your frontal? Your next, we're going to be palpating in with the laminectus apparatus, which is right here underneath his outer eyebrow. Any tenderness there? Okay. Next, we're going to be having him open and close his mouth, and we'll be feeling in his temporomandibular joint in there, or otherwise known as TMJ, and he did not have any popping or clicking. If he did, then he might possibly have some TMJ issues, but he did not, so we are all good there. Next, we'll be using my pen light again, and we will be looking at his mouth. We'll be looking at his mucosa. We'll be looking at his anterior posterior pillars, his tonsils, his uvula, his teeth for any cavities, his tongue for the consistency, moisture, looking for any lesions, moles, any different coloring in there whatsoever. We're also looking at his lips, which are moist and dry, which are moist, they're not dry. There's no cracking in them whatsoever. And we're going to be having him say "aw." So if you could open your mouth and say "aw" so we can see your tonsils move. It looks great in there. His posterior and anterior pillars look great. His uvula is moving. He has no foul odor. His teeth look good. He does not have any cavities whatsoever that I can see in there. His tongue is moist and red as well, so it looks very good. Next, we are going to be moving down to his neck area, and we'll be looking at his neck. So I'm going to have you move your neck all around for me, and he has a good range of motion there. If you can shrug your shoulders up and down. Okay. And if you could go with resistance to my hands and shrug your shoulders again. Thank you. You could put resistance to your face in my hand, and then this side. Thank you very much. While he's sitting up this way, I'm also looking at his neck and his skin and his coloring. Throughout the whole assessment, we are looking at his skin and looking for any moles, lesions, anything, scarring, anything that we see out of the ordinary. And so far, everything looks great. His neck looks good. I don't see any, with him just sitting here, any venous, jugular venous distension. You can also be checking it when he's laying down, if you see any, of course, at a 45-degree angle. But it looks good, and there's nothing there right now. His trachea is midline, so it looks good. You lift up your head for me. Trachea is midline and looks good. Next, we will be palpating his lymph nodes that are palpable. So his pre-auricle is up here, his post-auricle, his occipital, and we're going to come down around to his tonsillar, his submental, to his submandible, and then we're going back to his posterior cervical chain, and through the superficial cervical chain, around to the deep cervical chain, and then to the supraconvicular right through here, which is sometimes hard to feel down in around in here. Next, it looks great. We'll be actually feeling both sides of his carotids one at a time, and then we will be listening. I do not have a bell on my stethoscope. I have a Lippmann Master Cardiology, so we are just going to be pressing lightly, listening for a bruise at that point in time. We are also going to be looking at palpating his thyroid and listening over it. If he had a goiter, we'd actually be able to hear something, but he does not have a goiter. So I'm going to palpate each of your carotids. And now we're going to be listening to each one of his carotids, and then over his thyroid. If he lifts up his neck, I'll listen. Okay. Now we're going to be feeling for his thyroid, so I'm going to put 3 fingers and slightly move his trachea out of the way as he swallows, so if you could please swallow for me. Okay, and please swallow again. Okay, thank you. And his trachea is midline and feels great as I was doing that, and his thyroid is palpable, and I don't feel any lesions or bulges in it whatsoever. Next, we are going to be moving down to his hands and arms. So we'll be looking at his skin again and making sure everything looks quite well. And of course, I've washed my hands before we've started any of this, so I'm about ready to cough, so I'll be going to have to wash my hands again here in a minute if I do cough. Next, we're going to So I'm going to come over here and wash my hands again because I coughed. And then come back over here. I'm looking at his hands and arms and skin. They look great. He's warm. All his extremities feel good. It's warm to temperature. They're nice. And we're going to be looking at his cap refill. His cap refill is less than 3 seconds. I'm going to be feeling for his radial pulses. And now his brachial pulses. And then I'm going to have him lift his arms up, and I'm going to be feeling for his axillary lymph nodes. Sorry if you're a little tickly in there. And in here also is his inferior clavicular as well, but he's a little tickly in there. Next, I'm going to have you make like a little timing thing for me. Thank you very much. And next, we're going to be moving on to his back and his chest. So I'm going to come around to his back, and we are going to be looking at his back. It's all symmetrical and not. If he could bend over forward a little bit for me, you can see his cervical spine is in place. It is in alignment here. While we're on his back as well, we are going to be palpating his crostiovertebral angle. So I'm going to palpate right here and right here. Did you have any tenderness in that area?
Mm-hmm.
Okay. Next, we're going to be having him repeat the words 99 as I put my hands over his back, and we are basically feeling for his tactile firmness as he says this. So if you could say, please say 99.
99, 99, 99, 99.
Okay. And I did not feel any. I felt it, and he felt good. You could feel the vibrations through when he said every single one of those. Next, we are going to be looking at his expansion. So I'm going to make my hands like this, and if he could please take a deep breath in and out. Okay, and my hands expanded in and out like they were supposed to. Next, we are going to be listening to all his back sounds, and then we will be palpating for his diaphragmatic excursion. I'm going to have him lift up his arms, and I'll list both lateral sides as well. Okay, and I'll be listing on this side. Okay. Next, we will be palpating down his back for the diaphragmatic excursion, both on each side. And of course, the right is expected to be a little lower than the left. Let me grab my tape measure here, and we will be measuring for that. And we are looking for when it goes from dullness to residence. And that was down here. And then we'd be making a mark right here. And then now we're going from residence to dullness, and then we would be making a mark. And then we'd make a mark right here, and then we would measure in between the 2 points with the tape measure and measure, and you want it in between 3 and 6 centimeters would be normal, and his looked like that. It was about there. So if you could take another deep breath and hold it for me. You can take a breath, and then take another deep breath for me, and then I'm going to be going back up to going from the residence to the dullness. And then I'd be making another mark and then measuring it with my tape measure again. And you want it in between the 3 and the 6 centimeters. And his was that. Okay, we'll be going around to his front. We'll be looking at his chest and lungs from the front area. And his respirations look equal, his chest looks symmetrical. So we are going to have him say 99 again, if you would please.
99, 99, 99, 99, 99.
Okay. And next we are going to be listening for his lungs. And I'm going to palpate his chest as well. So we'll palpate his chest again. And we're listening for the dullness him there, and it was dull. And next, then we will be listening to his lungs, and then we'll be lungs, and then moving on to his heart sounds as well. So he's taking some deep breaths again for me. Okay, and next we'll be listening to his heart sounds as well. So we're going to start with the aortic, looking over to the pulmonic, the herbs, the tricuspid, and now the mitral. I'm going to have him lean forward a little bit, and we'll listen for some aortic, see if he has any aortic regurg. And he does not, so we'll have him sit up again. Next, we'll be having him lay down so we can feel for his PMI and looking and feeling for some either any heaves or thrills that you might see. So we're going to be feeling on his chest and looking on his chest for any heaves or thrills. And I don't see any, and you don't feel anything on his pericardium that feels good. So next we're going to be moving and trying to locate his point of maximum impulse, which is also his apical pulse, and we'll be feeling for that as well. And you can feel that just fine. So he's good on those things. Next we will be moving down to his abdominal area. So we are going to be looking at his abdomen and seeing and making sure it's flat and its contour. So we would get down and look, and his abdomen is flat. He does have a scar, which I know is from his history that we took from his actinidectomy that he had as a child. So that's there, and that's noted, and that's the expected finding that we would find. His abdomen's flat and soft and contour. So next we will be listening for his abdominal sounds. We will be listening in each quadrant. If I did not hear any, I'd be listening up to 5 minutes. And he has very good abdominal sounds. And while I'm here, I'm also going to be listening for his aortic artery, his right renal, his left renal, his left iliac, his right iliac, and then we'd be moving down here, of course, down to his femoral arteries as well. And they sounded just fine. You didn't hear any uproots or anything in those arteries as well. If you could take a little mini crunch for me, we can test your abdominal muscles, and they feel great. Next, we're going to be palpating for his liver borders edges. So we're going to go down his mid-clavicular line, and we're going from the dullness to resonance. You can feel it right in here. And then now we're going to be we'd make a mark, and then we'd be going back up. And he would be right in here. So here's where his liver borders would be. And then of course we would measure those and see if they were in the area that we wanted them to be in. Next we are going to be palpating for his liver. So I'm going to have him take a deep breath in and then let it out. And you can feel his liver right underneath a little bit right up here. Next, we're going to be palpating for his spleen. And then you should not feel his spleen, and we do not feel his spleen. You would feel it if it was enlarged. Next side, we are going to be feeling for his right kidney. You can kind of feel it in there one. and then you can feel it over here. And then next we're going to be palpating his abdomen. Some light palpitation first. Any tenderness at all? Okay. And then now do some deep palpitation, and we're feeling for any masses, hernias that we would feel in there. And no, we don't feel any masses or hernias or anything like that. And his tummy is fine and does not feel tender at all. When he's laying in this position as well, as he would be a little bit inclined with a 45-degree angle, have him turn his head to the side. If it did look like when he was sitting, if we saw the venous jugular venous distension, then we would have him turn his head, and then we would be measuring it for him in this triangle area. But he is not, and you can't see it at all when he was sitting or laying, so we will not be measuring for it. I am going to have him roll to his side really quick, so I can listen for his ablative rearch. And I don't hear anything at all, and he's fine. Next, I'll have him roll back to his back. And I'm going to be feeling up his pant leg a little bit and feeling for his popliteal pulses. And then we'll come to this side and feel for the other popliteal pulse. Okay, and then we will be feeling for his posterior tibials and his dorsopubis. As I pulled up his legs, it was testing for his pulses, which are all +2 and feel great. They were not bounding or threading. His legs were symmetrical. His hair distribution is equal. His legs were not shiny, and he did not have any edema noted in them at all. So next, I'm going to have him sit up, and I'm going to get my reflex hammer, and we are going to be testing his reflexes. Now, when he came in the room, we already noted that his gait was normal. He did not have any limp or anything like that. So I'm going to test his reflexes. And then I'm going to be testing his other brachial. Okay, and then we'll be doing his knees. Hold up the pant leg so I can see it here. And then he'll be, okay, and then we'll pull up his other pant leg and do his other side. Okay, and then we'll be hold it up for a second. We're going to test your Achilles tendon. Okay, and then this Achilles tendon. Okay, and then next we're going to see if his grips are all equal, so if you can push on my hands, resist against me, squeeze my hands. Thank you. And then we'll be to push your hands like a gas pedal. Thank you. And his grips and everything were all equal. His gait was fine, like I already said, so he's good there. And I think that includes this assessment. Thank you very much.
Right.